I'm just here to check your baby and give her an assessment today. I'm gonna first start off by checking your ID bracelet. Alright, that checks out. And I'm gonna take some vital signs, and I'm gonna take the temperature. That's underneath the armpit. And the normal temperature is 97.7 to 99.5. I'm gonna go ahead and take a pulse and listen for a full minute. And that should be between 100 and 160. And I'm going to listen to respirations while I'm here for a full minute as well, and that should be between 30 and 60. And I'll go ahead and listen to heart sounds while I'm down here. The breath sounds. And also the bowel sounds. I'll start off by looking at the head, and I'll take the hat off. So I'm just feeling around for molding, which is overlapping of the cranial bones, and then looking at the soft spots or the fontanelles in the head, and also at the sutures and where those are at. And if there's any presence of caput succuteneum, which is normal, it's a little bit of fluid in the head. And then I'm also looking for cephalohematoma, which is blood underneath the head, and that is not normal. And then there's also no scratches or bruising on the head. And then now I'm going to look at the eyes, and the eyes are normally placed, which is like 1/3, and then the nose, and then another third of the face is the eyes. And then they're symmetrical, there's no discharge. The folds are correctly, there's no epicanthal folds, which could be indicating of Down syndrome. And then the ears, those are lined up how they should be with the eyes. And now I'm going to check the cartilage and see how fast it recoils. And that is normal, and if it doesn't recoil as fast, then that means that it's premature. And then I'm going to check patency for the nose. So I hold one side, and then I feel a breath out of one nostril, and then I do the other side. And then for the mouth, I'm going to put gloves on for that. So I go ahead and slide my finger in, and I feel the palate on the top to make sure that it's rounded and normal. And then I flip my finger over to see if the baby sucks, which it is, and that's normal. And now I'm going to check the head range of motion. So I'm going to turn it to one side and then the other one. That moves really easily, that's normal. The clavicles, they are intact. I'm going to check the skin. There's no bruising, there's no birthmarks or rashes. And then I'm going to look at the back to see if there's any linguino, Lego, and there's just a little bit, which that's normal. I'm going to cover the baby back up. And then I'm going to check the 5 places for jaundice, which I'm going to press down on the skin and I'm going to blanch it. One on the forehead, one on the chest, and the abdomen, and then the inner thigh. And I also check the eyes, which those are white, so the baby does not have jaundice. I'm also going to check for respiratory distress, so nasal flaring, which the baby's not having any nasal flaring. Retractions, so the baby does not have any retractions. There's no grunting sounds coming from the baby. There's no seesaw breathing, which the chest and the abdomen should move together. And then I'm listening for any like stops in breathing, like feeling, and if it's more than 20 seconds, then that's apnea, which the baby doesn't have that, which is really good. Now I already listened to the bowel sounds, so I'm gonna feel the abdomen to make sure that it's flat, which it is, which is normal. And I'm gonna also check the cord to make sure that it is doing what it's supposed to be doing, and it's drying out, which is normal, which is really great. I'm gonna go ahead and put some more gloves on. Alright, there's just a little bit of discharge, which is normal, which is okay. And the diaper doesn't really need to be changed, so there's nothing, no like wetness or feces or any of that, so that's good. And then the labia is where it should be. And then if this was like a male, we would check to see where the testes are and where those are located, make sure that they're dropped a little bit. And the foreskin, and if they're circumcised, we make sure that the circumcision is good and intact and not bad. So then we put the diaper back on and make sure that it's folded down so it's underneath the umbilical cord. Next, I'm going to check both arms and both hands to make sure that there's creases. There's only one crease in the palm, then that could indicate Down syndrome. And I'm making sure that there's 5 fingers on both hands. Now I'm going to go down and look at the soles of the feet and make sure that there's creases. If there are creases over like half of the foot, half of the foot, then that's not very good. No, that's good. Okay. And then I'm going to check the Babinski sign. So I'm going to start at the bottom of the foot and then go over through the top of the big toe, and they should flare open like that. That is normal. Now I'm going to turn the baby over onto its tummy. I'm going to go ahead and look at the hip area and make sure that the hips are symmetric. I'm also going to check to make sure that the spine is straight and symmetric. I'm also going to check the folds of the thighs to make sure those are there, which also helps with hip alignment. I'm also going to see if there's like any hair down here, and hopefully there's not a lot of hair, else that could be bad. I'm going to go ahead and turn the baby back over. I'm going to check the Moro reflex, and that's where you bring the arm 3 seconds forward, and then you put it back down, and then it should go back up to right here if that's normal.
It's just a recoil.
It's a recoil reflex. And then I am listening for the baby and checking its behavioral and stuff like that to make sure that it's doing normal. And then I'm also going to ask the parent if the baby's voided lately, like when they changed the diaper last. I can check like the record to see like when the baby last voided and bowel movement. And then baby also needs to eat every 2 hours, so I would check that too. And I'm also going to check the Moro reflex. This one's the Moro reflex, the other one was just the recoil reflex. Okay, so this one you hit the table and then the baby should go like this and then go back in. Okay, alright. And then I provided safety and warmth throughout the whole entire assessment. Alright, yeah.